Hello everyone and welcome to this symposium sponsored by Trio Healthcare. During this symposium we're going to be exploring breaking the cycle of skin damage using SIL2 technology. So this symposium will introduce the world's first SIL2 breathable silicone technology. This is a new approach to stoma care that can help provide an alternative solution to hydrocolloids. There are 3 speakers in this session. Myself, Karen Uzi. I'm Professor and Director for the Institute of Skin Integrity and Infection Prevention at the University of Huddersfield. I'll be followed by Dr. Thomas Swift, who's a lecturer in Polymer Chemistry, School of Chemistry and Bioscience at the University of Bradford, and then Alfred Levy, Anne Marks and Scott Clifford are Ostomates from across the UK, and they will also be speaking to you. So I hope you enjoy the symposium and that you have plenty of questions to ask us at the end. I'm going to focus though on skin damage and is there an issue, and this is with ostomates. So before we actually start the session, I'd like to give you a little bit of background data. And I know that many of you will know this, but it's always good to reset the context. And within the UK, we estimate that over 13,500 people have a stoma each year, which equates to 1 in 500 people actually having a stoma in the UK. And that's approximately 177,000 ostomates nationally. It's a huge amount. And from that, we can guarantee that some clinician will be looking after a stoma patient somewhere, and that all clinicians will be looking after a stoma patient at some time in their career. But sadly, up to 85% of ostomates have experienced common problems such as skin irritation, blockage and leakage. So this is why this session is going to talk about managing the skin, because it is so very important. But first of all, we really need to know about the skin itself. And many of you will already know this, but it's always good to have a recap. So skin is the largest organ of the body, and it makes up about 15% of total body weight. And it's quite a complex structure, as you can see from the diagram in front of you. Lots of bits and pieces in there, including hair, sweat glands, veins, arteries, hair follicles, etc. But really, the 2 things you really need to know is that there's 2 main layers, the epidermis and the dermis. And these are layers of skin that are likely to become damaged on an ostomate when they remove and apply the ostomy bags on a regular basis. And this is the area we really need to be protecting. So it's the stoma itself and the area around the stoma, known as the peristomal area. If you get a chance, it's always worth going and having another look at physiology of the skin, just to remind yourselves of what it's made up of. But also many functions of the skin, and it's so important that we're aware of this great organ and what it can do. It looks after sensation and protection. It also excretes, it thermoregulates, and it does vitamin D synthesis. And when talking to your patients, it's always good to remind them about the skin and how much they can tell about their own general health. We've often looked at patients whose skin looks very dry and fragile and looks like it could rip quite easily, or that we see lots of skin tears. And that's often because the skin is dehydrated due to lack of nutrition, or actually just drinking enough and not moisturising the skin. So just remember to explain to patients about the skin, to keep it moisturised, to drink plenty and to eat a well-balanced diet. But we also have to think about medications. Some medications can cause damage to the skin by making it very dry, then we get skin tears, or making it so dry that we're at risk of skin stripping as well. Patients need to know about this because they're often looking after their own ostomies at home, so they need to know when to refer themselves for some extra advice to the GPs or the nurses. So the skin is the largest organ. It's complex. It has several functions that could be compromised. That includes trauma, sun, immobility, pressure and chemicals. We also have factors that we can actually make a difference to. So dryness of the skin, we can help that by ensuring the patient's hydrated. Age. From a very young age, people are more at risk of skin damage, And again, as we get older, we're more at risk because our skin tends to dry out. And again, we're on medications that can affect the skin. So giving some good old advice on what to eat and what to drink. But skin damage can also be caused by acute and traumatic wounds. So any insult to the skin can cause a wound. And that can be an acute surgical wound or it can be a chronic wound. These wounds, chronic wounds, we mean wounds that have lasted probably over 6 weeks. And of course, ostomy sadly can cause skin damage as well. So what can actually go wrong when we're talking about skin damage itself? Well, these are two terms that I'd really like to have a quick look at. Sure, many of you already know them. Medical adhesive related skin injury, also known as MASI, and moisture associated skin damage, known as MASD. They're not particularly new terms and they've been around for many years. Moisture associated skin damage is particularly prevalent in tissue viability, where we can see pressure ulcers, but they've been exacerbated by moisture associated skin damage, so incontinence or heavy perspiration, for example. Again, tissue viability, see many medical adhesive related skin injuries caused by wound dressings that tend to stick very well or too well to the skin itself, and this is an issue in ostomy practice as well. People have often said to me they think MASI is an American term. It's not. We use it here in the UK quite a lot, and there's some best practice documents on both of these that you're able to download from the Wounds UK website free of charge. So how do medical adhesives cause skin injury? Well, we know medical adhesives can sometimes be really quite strong, and what happens there is the skin to adhesive attachment is stronger than the skin to skin attachment. And with repeated application or removal of appliances, such as your stoma bag, we can get skin stripping that then initiates inflammation, edema, and causes pain to the patient. And you can see here from these images how bad MASI can be. It's painful, it's red to the patient, and aesthetically it's really not very pleasing. But probably more worrying is that you've got to put the ostomy bag back on that skin that's already quite painful and damaged. And this is what we want to avoid. And there's a range of different terms that are incorporated within MASI, including skin stripping, maceration, tension blisters and skin tears. But allergic contact dermatitis is something we really need to think about. Often patient's skin gets warm, we move the flanges on and off all the time, and patients can get some dermatitis there. If they do, you need to be thinking about, well, what can I use on the skin instead of maybe a traditional hydrocolloid? And there's a few different techniques around, including using silicone that can help protect the skin, because we know that ostomy patients can't just say, I'm going to leave the bag off for a few days to rest my skin. So do look at different types of flanges that are there. We also need to think about prevention, and prevention is key, and it's all about educating patients about skin preparation, especially new ostomates who may not particularly understand how important it is to keep that area clean and dry and to apply a non-stinging skin barrier to protect the skin. You should also select the appropriate medical adhesive, so look for flexibility on the bag and teach patients how to correctly put the bag on, so the product application, ensuring that the skin is in full contact with that peristomal area. They don't stretch the area, and they apply the stoma bag with a firm but gentle pressure to obtain the adhesion. And similarly of importance is product removal. We don't want people just to be pulling it off. It needs to be removed slowly, and removing the stoma bag by supporting the skin with one hand and removing it with the other. And of course you can use silicone adhesive removers just to help reduce pain and to help the bag come off a little bit easier. And again, we have moisture associated skin damage. Can be really very common both in tissue viability and in ostomy care. And again, you can see the images here that show how red and excoriated the skin is because there's been prolonged exposure to moisture. And we need to protect this peristomal area. That is so important. We need that redness to go down, and we need to reduce the pain for the patient, because as I mentioned earlier, we can't just leave the bags off. And again, MASD is an umbrella term. It covers periwound dermatitis, peristomal dermatitis, interrigo, and incontinence associated dermatitis. So all 4 of these areas come under that umbrella of moisture associated skin damage. So it's not just about excessive urine maybe or perspiration. There's lots of different areas within MASD. And it presents as inflammation of the skin with or without erosion and secondary cutaneous infection. So again, protect that peristomal skin. Use something that is gentle on the skin. And again, educate the patient, keeping that area clean and dry, using mild to low irritating surfactants and a low pH cleanser. Apply a non-stinging skin barrier to protect the skin, and ensure the stoma bag is cut and ordered to the appropriate size. Remembering, and of course letting the patient know, that the stoma can change size during the course of a day, and that you need to prevent leaks by educating patients about preventing ballooning and pancaking. So prevention is key and education is key. There is an issue with skin damage, and we're seeing 1 in 500 people have an ostomy at any one time. So we must ensure that we protect the skin and prevent avoidable damage, which is about educating patients and the carers, and also educating clinicians that are new to this area, because they might not know how to prevent damage to the skin. So thank you all very much for listening, and I'm looking forward to answering your questions at the end of the session. And here are the references if people would like to go and have a look and have a read up. Once again, thank you very much for listening.
Hi, my name is Dr. Thomas Swift, and well, thank you for tuning in to listen to this short talk on the development of the silicone wafers, which are hopefully used for the care of stoma patients. So I'm a lecturer in polymer chemistry at the University of Bradford, meaning I'm a material scientist more than a medical clinical practitioner. But my background's in a lot of biomaterials, and ever since 2018 I've been interested in looking at these silicone dressings which went on to be trademarked and used in the Trio Healthcare SIL2 formulation. We actually got involved. The product was in a fairly advanced stage when we entered the picture, helping with the final stages of the reformulation, and importantly material science testing and a conceptual understanding about what this technology is, how it works, and what benefits it should hopefully offer to ostomy patients. So the reason we need to understand it, and the goal of the SIL2 technology, is to bring 3 key benefits over traditional hydrocolloid wound dressings. So whilst these flanges, which should be used on the ostomy bags, should still adhere to the skin and provide a stable attachment, when they are eventually have been used up and are no longer required, you should be able to remove them much more easily. They hopefully would have a reduced peel strength, which means less pain upon the removal. In addition to this, whilst you're wearing the product as a dressing coating the skin, one of the problems with any sort of covering that occludes sweat and other forms of moisture is that it reduces your breathability. It's an extremely important component, and by increasing what we call the transepidermal water loss, the TUL, we allow moisture to pass through the material, which should make your skin feel much more comfortable whilst you're wearing it. But overall paramount over both of these is the concept of product stability. Now, in short, by that I mean the product shouldn't change its structure during the time period you're wearing it. I'll explain a little bit more about that in a minute. So, in short, when we were asked to look and comment upon these silicone materials and suggest some formulation changes to them, the things we were looking at were the peel strength. So this is the kind of rig that we've got set up here at the University of Bradford. A lot of places, when you are looking at the attachment of any dressing material and how it attaches to a surface, they are usually compared by looking at how the material attaches to either steel or glass as a surface, but nothing compares like other forms of skin. And so the best way we've got of actually recording the force it takes to remove a product from someone's skin after a time wearing it is to use the forearm skin And then this custom rig at the university actually allows us to measure the force in newtons per meter as we peel back an approximately 8 centimeter long strip of material from someone's forearm. So we've got in here two data sets. These are the SIL2 prototype flanges supplied by Trio Healthcare, and we have two of them which are measuring a force of under 0.01 newtons per millimeter. Now they do adhere fine, there's no problems of them slipping off and removal, but across 4 different hydrocolloids, we're not naming them or giving any details away, but there's a bit of variability in the different products on the market, but we have 4, all of them are between 2 and 4 times more force applied to the skin when you remove it. Now, any force applied when you remove the product means you have the potential of stripping away proteins or other components of your stratum corneum, essentially what makes the surface of your skin up as you remove it. So if you strip them away, if you apply too much force, that can actually be problematic, particularly if you are applying and removing constantly, not giving the skin sufficient time to heal between each application and removal. The second component, as I said, is breathability. So we have a working model of an understanding about how this technology operates compared to other things on the market. Is that as you wear them, the hydrocolloids are a traditionally hydrophilic material. This means that they like water. If you put a droplet of water on them, it will spread and it will slowly be absorbed in. Now that means it's absorbed and the material actually swells over a period of time. And that's really good. You prevent build-up of moisture on the surface of skin. That's good for preventing diseases and other things, infectious things from occurring. However, it does mean that there's not really what we call a sufficient tulle in the product. What you actually have is moisture passing out of the skin into the product and then being retained there. There's still a build-up of moisture in the local environment. Now, silicone's a really interesting material because it is itself intrinsically hydrophobic. It doesn't like water, it's water repellent. And that means that there is actually a buildup of water underneath the material's surface. But the SIL2 technology has been formulated in such a way that although it does minimize it, it's not free flowing, there is a controlled amount of moisture transport through the material, meaning it does actually have what we consider quite a high transepidermal water loss, quite a high tulle value comparative, not quite as high as skin, but essentially in this context, the higher the better. And that is actually an extremely odd thing for a silicone material. Silicone is often used as a hydrophobic coating. So you've got here an example of what would happen if you put water on a hydrophobic coating. It essentially is repelled. But the silicones used in, the modified silicones used in the SIL2 technology, they have been modified to permit a sufficient amount of water penetration. This is good and healthy when it's worn as a dressing or a flange extender over any period of the skin. So thirdly, and importantly, I mentioned stability, and the concept I said of the hydrocolloid acting by absorbing moisture over time, which means it swells, it increases in mass. This actually is a detrimental effect on product stability in the long term. We've been doing a lot of extensive testing of trying to actually break down these materials and look at how far they can be taken until they eventually decompose. But really, in order to conduct this study properly, we have to carry out a participant study. So this is separate and distinct from anything that's been carried out on the SIL2 for nursing and regulatory terms. This is actually us looking at it from a material science perspective. How can we understand the advantages and disadvantages of materials? Now, COVID's been an extreme annoyance in carrying this out. Universities have not really been ideal place to recruit volunteers over the last 2-year period, but we have now begun to begin work, and by working in smaller mini trials rather than one big one that we'd originally pitched for, we've done some work looking at comparing silicone and hydrocolloid flange materials on looking at patients' forearms and their torsos to get an idea of how these materials actually activate and work and function when they're on our patient's body. So these are worn for somewhere between 6 hours or 24 hours of time, depending on the stage of the mini trial or the preference of the participant who's wearing it. You've got here a three-dimensional photograph. We're using a polarized camera to reduce any sheen or glare from other light sources and get us a three-dimensional view of exactly what these dressings are doing to the participant's skin. So looking at either 6 hours and 24, we've taken pictures before the dressing go on, and we look again after the dressings come off, whilst also monitoring the tulle, the peel strength, and then afterwards take away the dressings to testing afterwards. Now, in the first of these mini trials, the blue area shown in this photo and the red area, this is the worst example we observed of kind of inflammation of the skin, a negative reaction of one male participant to the silicone dressing. So this participant did say they have not dermatitis exactly, but they are potentially have some vulnerability in their skin, and they observed no irritation or rash on the wearing of the silicones for the 6-hour period, whereas they did feel potentially uncomfortable at the end of the period wearing the hydrocolloids. So once we've had the participants wearing these for the period of time, we take them away and we're actually counterstaining them so we can try and quantify the amount of silicone protein that has been removed and stripped away from the upper layers of the skin. As I said, normally removing some proteins, there's always some loss of exudate material from the surface of your skin. But what you want is the removal to be at a rate that's sufficiently low for your body to heal and replace what's lost. We are trying to work on the counterstaining mechanism so we can quantify the amount of removal. What you can see there, the spotting on the hydrocolloid is actually proteins that have been stripped away from either the left right arm or left and right torso. The silicone, you don't see these spots in anywhere near as much detail. What you actually have there is a bit of a problem of the counterstain actually showing up on the silicone, which is why we're still working on this technology. But we are at a point where we are able to scientifically quantify and say that the amount of protein stripped from the upper layer of the stratum corneum, the amount of material removed from your skin on each removal, peeling away of the hydrocolloid versus the silicone, is a level of magnitude higher for the hydrocolloid, making the silicone, just on the fact of when it's removed, ignoring the comfort of wear during the wearing period, hopefully a healthy option for your skin. So thank you for listening. I hope you found that sort of look of what on a material science perspective we were looking for when we were developing this technology. If you've got any questions, I'm more than happy to answer them. We're still, because of COVID has delayed us, we are still rolling out the final stages of this study, and we do hope to publish it as a full result when we complete. Thank you very much for listening, and I'd just like to thank Jill Westgate and Dr. Twigg, who have been my collaborators in putting this project together, and all of the assistants at the University of Bradford who have been helping with these participant studies.
My name's Alfred Levy, and I live in a village near Bedford. In 2006, I learnt that I had bowel cancer. And having had a minor operation, they decided, no, I've got to have a major one. And I went to hospital and had a colostomy. I did this evaluation for Trio, and what amazed me was the new silicone adhesive that they're using stuck to me much firmer than any others that I'd used before. And it moved when my body moved. Now, if it's a very hot day and whatever, you sweat and the pouch can move and it can leak, and that's what can cause the problem. The whole 2 weeks, and 2 weeks isn't a very long time, that I tried the product, I didn't get that problem. I didn't have a leak. I didn't have any pancaking, and I felt, what a good product. And I was sorry when I'd run out of the samples.
Hello, I'm Anne. I'm 65. I've had my ostomy for 20 years. My skin was very sensitive when I first had my operation, and before my operation I had to be tested for various adhesives and bags to find which one would work. I'm really looking forward to this new one that Trio are doing. It's come just at the right time as far as I'm concerned. Once it was on, you couldn't feel it. I knew it was there, but it just moved with my body. I didn't feel it. So I don't know if that's the right answer, but I couldn't feel it at all. And the very, very best thing for me is that after being in the water, I didn't then have to use my fingernails and get rid of all the gloopy glue afterwards. I could just take it off, and my skin was as clean as it was when I put it on, and that is just such a bonus. There were no gaps. Although you couldn't feel it, it stuck incredibly well. There was no redness. There was no bits of adhesive left on it. I'm not saying it was as smooth as a baby's bum, but it came pretty close to it. And there was no sort of... Normally when I take a bag off, there is a sort of a slight redness around where the bag's been, but there was none of that at all. I think it's a real game changer, because anybody who does anything whereby they get a bit hot and sticky and sweaty, or they bath or shower with their bag on, is going to find that it won't make a difference. They won't have to think, oh, I have to use my adhesive remover, or I have to use adhesive remover wipes, or whatever. You'll be able to do it knowing that your bag will come off as easily as it went on, and still leave your skin looking brilliant, the way it was before.
Hi, yeah, my name is Scott Clifford. I'm 50 years old and I've had a ileostomy for the last 17 and a half years. So my ostomy story, I was diagnosed with Crohn's disease at age 17. I lived with Crohn's disease for about 15 years and then it was felt that to get the best quality of life, that it was best for me to have a stoma. So I had an ileostomy formed about 17 and a half years ago and I've been living with a stoma ever since. Having the new Trio silicone flange was really exciting when Trio contacted me to ask if I'd be willing to trial the product. As I say, I've had a bag for about the last 17 and a half years, and the hydrocolloid product itself, which is typically what most people use, was revolutionary when it came along sort of 40, 50 years ago, because it meant that we could stick a bag directly onto our skin rather than using a paste or a gum and then a spirit to remove it, for example. Having something like a silicone product come along is very exciting for somebody like me as an ostomate, because it means that there's a new product coming onto the market. We're seeing new research all the time in terms of these products, and it's giving people a better quality of life. How I found the silicone product over the hydrocolloid product is I found the silicone product actually clung to my skin. So in my experience, and many people with a stoma have different experiences, but in my experience of living with a stoma using a hydrocolloid product, I find that the flange itself that sticks to the skin will often peel at the edges. And it's very important for somebody living with a stoma that they have complete confidence in the product that they're using, because that confidence means that they can go out the door and do the things that they like to do on a daily basis. What I found so innovative and exciting was the fact that the silicone flange just clung to my skin. There was no peeling, even after wearing the bag for days on end, and it gave me real confidence. So in terms of taking up a new activity using the silicone flange, what I found was, because I had greater confidence in my product, where the product itself wasn't peeling, not only did it mean that I could wear my bag longer, but it meant that I could go out and do new things, like exercise, for example, without having to worry about whether the product was going to come off for me. So the silicone flange itself gave me great confidence in wearing that, and just to go out and focus on doing the exercise. So I think it's exciting about the innovation of the new silicone flange coming on board, because, as I say, it's great for us as ostomates to see the research that companies like Trio are putting in, for example. It's great that we are getting new products and that there is new investment into the market, because it means that we can continue to enjoy a great quality of life and hopefully improve that quality of life. In terms of what this might do for ostomates going forward, I think it's going to give them a real choice. And choice, as I say, is something that we've been very lucky to have in the UK market. But in terms of flanges or hydrocolloid, that primarily is the only offering that's available to ostomates. But bringing a silicone flange on board as well, you're effectively opening up the market to them so that they can get the benefits from a silicone product.